what kind of expectations should you have when you're trying to increase the size of your breast using fat? And that really depends upon how much fat we're going to transfer. So for me, for most people, my target is about 300 cc's or milliliters of fat per breast. In order to do that, I generally have to remove about a liter of fat from somewhere to get enough fat to then process and bring down to that number. So, and that's the exact number actually that I got out of my patient 2 days ago. Now, there's some variability to that. Some people are going to have more fat, some people are going to have less, some people need more fat because they're going to be larger. And so it does depend a little bit upon your expectations, but you have to have some fat. You have to have enough fat to transfer to be able to do this procedure. And then the expectation has to be that that fat volume that is transferred is going to decrease. And I generally say about 60% of the volume is going to survive, and about 40% of that volume you're going to lose. So, my patient was ecstatic about how it looked immediately after the surgery, but I had to discuss, and we discussed this multiple times before she ever came in, that that is not a final result. That is not a possible result with fat transfers. That really is a breast augmentation result that she had yesterday. It's going to soften and look much more natural as time goes on. And then that natural volume really takes about 3 months to fully set in there.